Okay. Um, Today we wanted to share about our experience doing the step procedure on our daughter. She is shortcut, and she's currently 50 months old, um, and she's been NPO for how long?
About 3 months, 4 months.
3 months, 4 months. She has a very distended bowel. She was born with it. Uh, Very, very distended. I think it was like 8 centimeters wide. And I mean, all throughout all this year, we've been trying different methods, different uh, techniques to treat it. But we were unsuccessful every time. So anyway, we ended up doing the step procedure on like around 10, 11 days ago for post-op, and we just wanted to share how it went, and hopefully it will help other families out there, what to expect and how it goes. So we were admitted a day before the surgery. They just provided antibiotics, prepare her for surgery with antibiotics. She also needed a blood transfusion because her hemoglobin was very, very low, and thankfully my husband had the same blood type as my daughter, so we were able to donate blood a few weeks before. So they had his blood ready. So she got blood transfusion the day before. She got the antibiotics. She got more fluids, I guess, in the TPN, right?
Mm-hmm.
Just to prepare her bowels for the surgery. And the next day, the following day, we had the surgery. Oh, and they also were checking on the coagulation numbers on her blood, and they call it FFP, I think.
IPN was the number they were checking.
IPN, and they wanted that number to be below, like they wouldn't do surgery below 1.5, right?
Above 1.5.
Yeah, above 1.5. But her results showed that she was 1.3 at that time. They wanted it to be closer to 1, right? That was my understanding. But so because it was slightly above 1, but yet it was still lower than 1.5, they were okay with her having the surgery. Not just that, but like having the epidural. If you didn't have the right number, then they wouldn't recommend having the epidural. And as you know, these step procedures are very painful, very invasive, and very painful procedure. And we have heard many times from different sources that it was better to have the epidural. If you don't qualify for that, then you will just have to deal with morphine and other type of pain medications, and they don't work as well as the epidural. Anyway, we at one point we were kind of like, oh, maybe she's not ready, her coagulation numbers, but we ended up talking to the anesthesiologist, the surgeon, and we all agreed that that number wasn't that bad. So we went ahead and provided the epidural. And so the surgery took how long? They told us it was going to take like 4 hours. They were going to do the step plus bring an ostomy called the Bishop Koop, or also called
Ostomy or continuity.
Which is an ostomy where you get to use the colon, which is something that is very beneficial for these kids that have short gut, because they need to use as much of intestine as they can, since they don't have enough. So it's not very well. It's not used by many. We found that out, but in this hospital they believe in it and they swear by it that it works for this type of kids and with the dilated bowel. So we ended up doing that. So they were gonna do those two things, the step and the ostomy, and that was gonna take 4 hours, but in reality it took three and a half, maybe 3 hours. We were very surprised that it was that fast, and she did very well with the pain. Gosh, she was not in pain at all. Did you ever? She was just sleeping, very sleepy right after surgery. But then that night of this, the surgery was like during the daytime, like 2 or 3 o'clock in the afternoon, and then by nighttime she was just wanting to stand up and sit up and do things like normal. But we were trying to keep her calm and because she still had the epidural with her in her bag. They insert like a small catheter in the bag and they tape it very well. So we needed to be sure that needed to stay in place and not move. She was with the epidural for how many days? So 4 days, I think, 4 or 5 days. And at the same time, they were giving her antibiotics like Vanco, like the fluconazole, and this other antibiotic, which I don't remember. So just as a preventative measure for infection and things like that. Also, they also did a biopsy, like a liver biopsy and a small intestine biopsy, just to check her numbers. And so yeah, it was a very intensive surgery, but they did it very quickly. The doctor only did like 4 staples, which we were pretty surprised, because we were expecting, because her bowel was so dilated, it was going to be more staples, but no, he only put 4 staples there, and did the ostomy. So he said he found like around 65 centimeters of the small intestine, and after the step he believes he added another 10 centimeters, but it could be more. I mean, it's hard to measure afterwards, because it's hard to stretch it out and measure it, but that's roughly the number that he gave us. Yeah, so she was with the epidural for 4 days, and then she was doing very well. Like I said, no pain at all. We didn't need extra morphine or Tylenol, nothing. It was very well. We just needed to keep her laying down on her back and not moving. So I think that was the only hardest part of all, right? And then by the 5th day, I guess they started they started clamping her G-tube, because she also has a G-tube. So they started like clamping for a few hours and see how she was doing, and then unclamping, to give her that release, just to see how her stomach and her bowels were waking up, like testing them out. When they started doing that, she did throw up, right? The first day that they start clamping the G-tube, again, she was not being fed. She was NPO still. She started to throw up. I mean, the first time it was like a bright yellow color, and also they were venting her G tube, like I said, and that color was also yellowish, but mainly clear, right? Mainly like spit clear, but a tint of yellow. But yeah, the first day that they did that, she did throw up quite a bit, yellow, and it was a little bit worrisome because we were like, oh my gosh, is this good, is it not good, or what's going on? But that was only one time episode. The second, I mean, the following day that they kept doing that, she did throw up, but it was spit, like a spit color, clear, nothing, and it was not a lot. So, and so that was for maybe 2 days that they were playing around with her G-tube, right? Like clamping and unclamping to see how she was doing. And once they saw that, no more vomiting, no more, and she was also passing stools. Like I said, the ostomy that she had was an ostomy where you can use the colon, so she not only poops in the back, but she can also poop from her bottom. So she was also passing poop from her bottom, which was great to see that. Again, it was watery, mainly watery, mucousy. So after that, they started with giving her what this solution is called OR. It has some electrolytes or something like that. They said it's like Gatorade, but it's not. So they started giving her that through the G tube. Like, I don't know how much they started with. I'm gonna say 3 mLs or something like that, and every 4 hours, and give her 2-hour break in between. And so we did that for like a day, and she did very well. She didn't throw up. She was doing fine. So the next day, they decided to introduce the Elecare, the formula. And then we started at 3 mLs again, and it was 4 hours on and 2 hours off, like that throughout the whole day. And she did very well. So that night they increased her to 5 mLs, right? And then the following day, since she was still doing good, no throw ups or anything, they went up to 10 mLs of formula. Again, the same schedule, 4 on, 2 off. And by that time, they started to wean down on the antibiotics too. They stopped the Vanco. And so yeah, she did well with the 10. Then they went up to 12 the following day. I mean, we felt like they were going pretty quickly, like daily. They were going between 3 to 5 mLs. And we were not used to that, because the most that she ever tolerated in her lifetime was 11 mLs an hour, right? And so this was huge. I mean, wow. So we are currently 11 days post-op, and she is doing 20 mLs every 4 hours and 2 hours breaks. And she's also, when they started doing the formula, they also started to use the motility medication, the Augmentin, plus the nystatin. The nystatin is an antifungal, and that helps with the bacteria overgrowth that these type of kids tend to have. So that also was given to her while she was on the formula. So by now they finished, they completely took out all the antibiotics except for the Augmentin, which it's an antibiotic, but it's used for motility purposes, plus the nystatin. She's currently getting 200 milligrams of augmentin, and it's twice a day, if I recall correctly. And what else? Am I forgetting something else? So yeah, and she's doing very well. No throw ups. She's pooping at back and the bottom. She's not dumping, which is also a great sign. And she's starting to gain weight. So which is very very good. She never done that. And you can actually see the difference in her skin, like she's more pink, right? Before she was very pale, but now you can see a little bit of color in her skin. And like I said, they did also the liver biopsy, and the liver biopsy, they said that they each show like a fibrosis of between a 2 and a 3, so it's not really that bad. But after the surgery, her liver enzymes went up, the ALT and the AST or something like that. They skyrocketed 10 times more than normal. So that was a little bit of worrisome, because that usually indicates some kind of infection or something going on in there. They did many ultrasounds to make sure that there was no bleeding, because sometimes when you do a liver biopsy there's a risk of bleeding or things like that. But so far everything has come out clear, so they really don't know what's causing it, these numbers to be so high. So they did lower her lipids in half. They cut down the lipids. They took out all these antibiotics, because they also said that all these antibiotics sometimes affects the liver too. And so they have come down a little bit, but they still are pretty high. So we're just gonna keep an eye out and watch. They also run cultures on her line. We did a UTI screening, to check for UTI infections, because again, when you are with the epidural, and she was with the epidural for 4 days or so, she was also with a catheter to help her pee for those 4 days. So, and that also raises the risk of UTI infections. So we also had to check for that. So the first few days, it was just a matter of keeping her still in the bed, not moving, just resting. But other than that, it was very pain-free, which we were very happy about. They did a very good job managing her pain here. And so far, like I said, it's been working good. She is making progress. We know that it's a very early stage still, and things can change. We know with these shortcut kids, one day is good, the next day is, completely bad. But this is the farthest that we have seen her go on feet, so that's pretty optimistic. What do you think?
Yeah, very happy with the results so far, and just hope that things continue in this same direction.
Yeah. So yeah, if you ever consider the step, we highly recommend you to use the epidural, because it does make a big difference. And again, each kid is different, and we will see what happens. We'll try to update you how she keeps doing in the future. The doctors are very happy with her progress, and to the point that they're thinking of discharging us pretty soon, like in a few more days. Their goal is to raise her milk up to 30, and once she reaches 30 we can go home, 30 mLs, and then we'll just come back for clinic weekly and work our way up from there. So that's that. Hopefully this will give you an idea what to expect, how it is, yeah, I mean, if you have any other questions or things, you can leave them down below. We'll try to answer them. We hope that this works. It was a very hard decision to come up with. We really didn't want to do the step. I mean, we have heard good things and bad things about it, but after a year of trying different things and going nowhere, we felt that this was the best thing for her. So far that's is working, so we'll see. All right, that's it for today. Thanks.